next skill we have here, it says on page 24, it says skill 2 applies 1 knee high elastic stockings. All right. So if you have 1 knee high elastic stockings after you've completed hand washing, you close the door for privacy, you go back to your patient. This is what you would then say to your patient. Miss Nafisa, this is Cynthia again. I'm here to apply 1 knee high elastic stockings. Is that okay with you? I'll be right back. Like we said earlier, the examiner is responsible for making sure you have all the equipment needed for the skill. So this is 1 knee high elastic stockings. I'm going to be standing by the door so that you will completely see what I will be doing. All right. We said we're wearing our scrubs for our GNA exam. So if your classmate has socks, you're gonna take the socks off. You cannot put knee-high elastic stockings on any clothing item. If it's still cold, like for instance, you're doing the exam in the winter and the patient or your classmate is wearing tights underneath their scrubs, then you would also move that out of the way. All right, so watch and learn. To apply knee-high elastic stockings, there is a specific instructions in doing this correctly. When you take elastic stockings, it has this hole at the end of it. The skill says fold the elastic stockings at least to the heel before you put the stockings on the foot and then on the leg. All right, so this is what you would do. You're gonna gather the stockings. This is the heel of the stockings, all the way to the heel and fold it onto itself. If we do not perform the skill correctly, we will not be successful. All right. So this is how to fold the elastic stockings. Then this is what you would do. The skill also says put the stockings on without leaving any folds. Okay. So as you can tell, putting the elastic stockings on requires a little bit of effort. Once the stockings is on the client's toes and foot, you can build momentum. And for the wrinkles that is here, I do not want you to pull the stockings all the way up and come back and use your fingers to fetch the wrinkles, but rather you take your wrinkles with you. Okay. Sometimes when you put elastic stockings on your classmate, there might be wrinkles underneath the patient's leg that may not be obvious to you, but it would be obvious to the evaluator. So you want to make sure you lift the leg up and completely get rid of your wrinkles. Okay. Once that's done, you cover your patient. And for our GNA, anytime we are dealing with a human being, you have 3 post skills, which is, Ms. Nafisa, this is your call light. I will bring my whole bed down and you tell the examiner I'm going to wash my hands. Okay. Once you finish your first skill, which is hand washing, subsequently, you simply tell the examiner you're going to wash your hands and get credit. If you do not tell the examiner you are going to wash your hands after completion of a skill, we've missed what? A step. Okay? Every time you finish a skill, you are supposed to tell the examiner, I'm going to wash my hands, all right? That signals to the examiner that you're done with the skill and you are now moving on to the what? Next skill, all right?